Well, it is February, and that is Heart Health Month, and we have a cardiovascular surgeon here with us today, cardiothoracic surgeon. We have Dr. Rafe to talk about heart health, and we're taking your calls. Actually, these experts will be here all day till about 5:30, and if people have a heart question, I mean, it has to be pretty serious before they see you.
It usually does. Usually they see their primary care doctor first, and the primary care doctor will start the workup, initiate it. They then will get typically to a cardiologist, and if they have surgical-based disease, then they'll come to see me.
And most of the time, you want to get people to catch this early. You can help them before it gets too bad.
We do. If they wait long enough till they're really sick and in the hospital, then it makes the recovery much longer and much more challenging.
And they could have a heart attack. It could be something more extreme that would cause a lot of damage.
That's exactly right.
So what are some of the first things that people should be aware of? Hey, wait a minute, this could be my heart.
There's many ways that heart symptoms can present. Oftentimes chest pain is the most common one we hear about. But fatigue, back pain, shortness of breath, any of those symptoms just are out of the ordinary should be looked into and addressed.
Well, and there are some treatments now. You can do pretty minimally invasive surgeries to help fix things.
We can. What I do is what we like to refer to as maximally invasive, but we've adapted now to do these through smaller incisions.
Right.
The advantage of a small incision is not so much to get people out of the hospital faster, but they tend to recover. They recover faster and without as much pain. So.
Well, you guys are almost miracle workers these days. You can see so much, and you have so many tools that can help you repair.
Right.
Pretty severe damage.
It's true. I mean, the technology over the last 10 years has changed dramatically to where we can reline entire aortas, through the groin rather than big incisions. We can replace valves now through the groin rather than big incisions as well. And it makes recovery faster and easier for patients.
Oh, I know my dad was visiting from Seattle just 2 years ago and had to have his carotid artery, some plaque removed, and he was back at home within a couple days and then flew home.
Right.
And we were amazed that he healed that quickly, and it was a pretty complex surgery, but he's fine. He's 90.
Yeah, it is. Patients can tolerate quite a bit. They get through these things relatively well, and getting to it early, like you said, is the key.
Okay, and we're talking diet, exercise. What screenings do you need? These folks have the answers here before you have to see him. We don't want any more patients for him. We want the answers today. So thank you so much. And if you have any questions today, again until 5:30 this afternoon, 877-908-0680, and it's free advice for your heart. Chase, the weather sure is